We'll share a link to that in the chat. That joins the whole archive of recordings and PowerPoints for the last year. There will be CME and continuing professional development credits through the University of New Mexico, where Project Echo is based. The link should be in the announcement that went out, and we'll share that about 15 minutes before the end of the session in the chat. And you've got 48 hours to complete that and receive your instant electronic CPD. We really appreciate your feedback. It helps us a lot to know how things are going and what you want to learn about in the near future. So it helps guide our planning. Just a reminder that these learning sessions are focused on improving patient care and health systems and supporting clinicians and patients. So please let's keep them apolitical and non-commercial. Thanks as always for that. Just a word about data use. Just a reminder, your individual data is kept confidential and we take data stewardship very seriously. We do share de-identified aggregated data with Rick and Asper so they can, HHS Asper leadership is well informed by these rounds. It is very much a bi-directional or multi-directional initiative. Rick mentioned that NETEC is a partner in these rounds, and they have a very timely webinar coming up next week on Ebola in the age of COVID. As I'm sure everyone is aware, there are new cases of Ebola in West Africa. And so this is definitely a timely event to tune into. It'll be next Wednesday, the 24th, and we'll share a link to their website and registration. Also, the Association of American Medical Colleges is a partner in these rounds, and they've been curating a clinical guidance repository for the past year, which they update regularly. Even though I haven't updated this slide, so it says updated January 14th, I know it's been updated within the last week or so. So the AAMC is really good about updating the site with clinical guidance. So we recommend that to you, and we'll share a link to that in the chat as well. With that, Rick, back to you.
So given today's topic, it seemed right to ask the following question. What have you and or your healthcare organization done to support school nurses? And reflecting back on, the invitation we extended to the National Association of School Nurses to present today, we actually had our presenters join us way back in August when the topic of school reopening was really forefront in the media. And it's really great to have them back. So anyway, yeah, if you could please put in the chat what your organization or you've done to be support our school nurses, that'd be great, so we could learn from each other. I'd like to have our panelists please unmute themselves and briefly introduce themselves. So I'll start with Dr. Thompson. Dave?
Hi, I'm Dave Thompson. I'm an emergency physician and faculty member at the East Carolina University and the medical director for Vidant East Care.
Welcome back, Dave. Dan?
I'm Dan Gerard. I'm a registered nurse and paramedic. I'm the EMS coordinator for the City of Alameda Fire Department, and I'm also the president-elect of the International Association of EMS Chiefs.
Thanks, Dan. Sandy?
I'm the Associate Executive Director for Clinical Affairs for the American College of Emergency Physicians, and I'm also an emergency doc.
And Harry?
Hi, I'm Harry Seibold. I'm an EM and EMS physician, past state EMS medical director for Montana, and consultant for the U.S. Forest Service, currently on COVID assignment in West Texas.
Thanks all. Welcome back for sure. I'd like to introduce our speakers today to help us get updated on school nursing and their challenges, successes, and the way forward. So we'll have both Laurie Combe and Susan Chaitis with us this morning. Laurie Combe is president of the National Association of School Nurses, coming to us from Texas. And then Susan Chidas is project director for community health and safe schools, and a nurse leader with student support services at the Los Angeles County Office of Education. So I believe I am going to turn this over to Susan. So if I messed it up, tell me, but I'm going to turn it over to Susan first. Thanks.
Thank you very much. Let me just get my screen up here. Okay. There we go. Well, thank you, Dr. Hunt, for inviting us back. It's, as you said, it's been 7 months since Lori and I were back here presenting to kind of give you an overview of how COVID was impacting school health, and in particular, what school nurses were doing. And so we're going to address some of the national issues. We'll talk about some of those things, but really Lori will be sharing some of her information, her experiences based on Texas, where she is from. And then I also will be talking about my experience in California, and in particular with Los Angeles County. So just to give you a little bit of a background on Los Angeles County, we have 80 independent school districts within our county, including the second largest district, Los Angeles Unified School District. So it's been quite the year, a lot of changes. I've actually been telecommuting for almost a year, doing lots of trainings and things with school nurses, working with, I think I'm in speed dial now with many superintendents and district administrators. So we just kind of wanted to give you a little overview. So the slide here shows kind of where schools are in their reopening process. So if you see in the green, those are districts that many of their districts within their state are fully open for in-person school. The yellow indicates those that are in a hybrid model. So anywhere from 1 day a week in person to more likely 2 to 3 days in person, and then a few days hybrid. So there's kind of some mixture in there. And then the blue shows that they are fully remote. So as you can see over on the left side with the largest blue, that's California, that we have many of our, or majority of our districts or schools are in full remote learning. But we're starting to open up, and I'll talk a little bit that in a bit. So in general, we have about 5 states, including Texas, that have ordered that their schools must be open. But it does allow for some local decisions based on their COVID-19 metrics in the area. We have 6 states and a US territory, including California, where that they have more schools in remote learning. So schools are permitted to open based on, again, the data and their county metrics. 40 states have no specific orders in place. Some states have strict guidelines for reopening. Others allow the community or the school districts to make the decisions based on their own metrics. In California, we now finally have some more extensive guidelines from the state, a state framework, as well as extensive guidelines from our local county Department of Public Health. It is based on our county metrics. We have no orders to open. But certainly they have been just approved some financial incentives to help entice districts to open. But even though we are permitted to open based on our county frameworks, school districts have the local decisions whether they open or not. So we have 80 school districts independent where they can determine whether they're going to open or not. So in general, there is some consensus that yes, we need to have students be in-person learning, both not only for the academic status, but also for their mental health. And if we look on focusing on who has access to in-person learning, what we have found that when you're comparing high poverty and low poverty schools, those in the high poverty communities have higher percentage of both fully remote learning and fully in-person learning. So kind of on the opposite ends, as opposed to being in the middle in the hybrid learning. Those districts with a lack of community access, in particular to broadband, resulted in higher rates of in-person learning as well. We have rural learners they're more than twice as likely to access fully in-person learning than their urban and suburban peer schools. We also have students in the Bureau of Indian Education schools that have definitely experienced challenges in accessing computers and Wi-Fi hotspots to enable their virtual learning experience for students. So just to talk a little bit about Los Angeles County and what our landscape looks like. We have probably about 30% of our elementary schools are open based on the local public health metrics. We have a state metrics or framework that has divided the transmission rates into and other metrics into tiers. And so Los Angeles County has been in the most widespread transmission tier for the entire year. We have not moved out of it until just actually a couple of weeks ago. And so there was a process where elementary schools could open in this wide transmission that began in the fall. So from that time, we've only had about 30% that are open. But as of March 15th, we have all K-12 schools are eligible to open. So previously it was only kindergarten through 6th grade. Now it's going up to our high school. So we do have been working extensively on providing guidelines for high school and middle school reopening. There are some concerns and some travel advisories regarding spring break. Our spring breaks are just starting to happen next week through the first couple of weeks of April, and concerns about what our landscape will look like after spring break. Unfortunately, or whichever way you look at it, we have many inquiries from our schools because of staff planning to travel during spring break and travel out of state, whether it's to see families or vacation. But we are concerned about that. And our requirement, our county requirement, is that they must, actually in our state requirement as well, they must quarantine for 10 days after coming back from being out of state. So that's going to create a staffing issue. So we've had a lot of collaboration between our Department of Public Health and our County Office of Education. So as a county office, we provide some general guidance, we provide some direct instruction to students, but working a lot to help provide some consistency for our 80 school districts within our county. Lots of collaboration with public health, and that's been a real plus. So some other issues that have been coming up have also included athletics. Our athletics have been open as per our state guidelines and county guidelines since the end of January. That has been permitted. So it's been interesting that sports have been allowed before schools have been allowed to be, some of them open. But we have had not widespread any transmission within the athletic teams. They were allowed to start off with conditioning and skill building. And as of the end of February, they were allowed to start having competitions or games. And so in particular for our team practices where they're having games, they've allowed not only our low risk contact sports, but also our medium and higher risk sports have been allowed. So for the medium and higher risk sports, you know, even though we're not in the higher tiers of lower transmissions yet, in general within our community, they are allowed to have games as long as parents have signed an informed consent so that they're aware of the risk and potential risk for transmission of having close contact. And then also our high risk sports such as football, rugby, or water polo, that they also need to be tested weekly, either by a PCR or a rapid antigen test. And those testing is being conducted by either school nurses or working with community partners or labs for conducting testing. We have seen some outbreaks, you know, probably just less than a handful of outbreaks in sports, but it's really been related to our community club sports or travel sports, where teams have traveled out of the state for tournaments. And then they come back and they're also participating in high school sports. And so it really hasn't been the outbreak within the high school teams, but really more from club and then bringing that into the high schools. So, so those are kind of where we're at. We are looking to see what kind of, if we're going to see a spike after spring break. So lots of messaging going out from our public health and collaborating that, dovetailing that messaging with districts and to students and to staff as well. Just a little bit of what Lori had shared about their Texas landscape, that the majority of schools opened by the second week of September. And COVID-19 spikes were seen after the holidays, Halloween, Thanksgiving, winter break. And then for the period from the beginning of August to March 7th, the cumulative rates for students was about 4.2%, of about 2.1 million students. This was in August, and currently about 3 million currently. Staff have about an 8.4 case rate that has remained constant. When we look at, in particular with staff, I think that's where we're seeing more of our spikes is as our elementary schools have, some of them have opened and we're reopening more now, that really the transmission, there's been very limited transmission among our students, elementary students. It's been more that it's kind of an outside case from the community or from home, and then we've identified them at school, and then they are go into isolation. Whereas more what we're seeing transmission, if it is occurring, transmission tends to be among the adults. They're very good at practicing their distancing, masking, hand washing, implementing all the layers of protection in their classrooms or while they're doing their work, but then they let down their guard when they are eating lunch, interacting with their colleagues, because, well, they're safe, and then they don't realize that that they've just exposed themselves or they've had some transmission. So that's really more where we've seen transmission has been in our adult population. So just to talk a little bit about what has been the school nurse role during COVID. And again, obviously we're doing a lot of care coordination and chronic disease management. So not only from as students have returned, but also nurses have been reaching out to, making home Zoom visits or whatever, checking on how is their care going and how are they managing, particularly those with chronic diseases, and to help be a resource for parents and student. But there's been obviously a lot of what we've been doing has been related to COVID. And so just looking at from last August, I think back as things were a little more disjointed and how we were approaching the pandemic. And now I think that we have a much more cohesive approach, not only from our federal, but also from our state and local agencies as well, so that we have much more guidance and interaction and collaboration on how we approach this. So the coordinated exposure management is really what takes up majority, is consuming a large part of our time as school nurses. Looking at safe school reopening plans, and being an integral part of that with the district management, doing school testing. So whether it be rapid antigen testing, doing pool testing for cohorts, or PCR testing. So nurses have been very much involved in that and working with our local or state run labs to do that testing. But a large part is doing the contact tracing. Particularly tracking down individuals, looking at quarantine, isolation issues, and really then communicating directly within 24 hours with our local public health department to help guide some decisions on whether classrooms need to be closed. Luckily, we haven't had to have any entire schools be closed related to outbreaks, but more related to classroom kinds of cohorts. Another piece has been vaccine administration. So we partner very well with our local public health so that we, as the sector opened up for education staff to become vaccinated or have access to vaccinations, our public health department and our county office, we work to link each school district or consortium of school districts with a local community agency. So either hospitals, acute care hospitals, or looking at community health agencies, or even looking at some of our school districts, a handful administer vaccines on school sites. But many of our, so we've been doing that for about 3 weeks now. And the actual need has gone down as far as the numbers of education staff needing to be vaccinated, because education staff are also open up to their own healthcare providers or healthcare agencies such as Kaiser, or even accessing the multiple county vaccine clinics or megapods that they were able to attend, and including local retail, such as our local retail pharmacies or markets that were offering the vaccine as well. So we've gotten a good number of education staff who have been vaccinated already, and probably within a couple of weeks we'll be starting on those second doses. So again, there's been some great collaboration in working with our local community partners. We've also had retired staff and some school nurses that have volunteered through the Medical Reserve Corps to volunteer for vaccine administration based on the availability, and also some who have also volunteered with our local public health department to assist in contact tracing as well. Some districts have even allocated their school nurse resources to assist with the community clinics, knowing that the community vaccine clinics were also vaccinating their own staff as well. I think another piece I've really been looking at, and even, well, and has been happening over the last several months, but also will be increasing even more, is to look at the mental health and mental well-being of not only of our students, but also our staff as well. We know we've been in collaboration with, or in communication with Children's Hospital of Los Angeles, and they have been noting that there's been an increased number in visits over this last year related to parents not knowing where to bring their children and taking their children into the ER due to mental health concerns or suicide attempts. And so while our numbers for our county have not increased for death by suicide, we definitely know that, again, from the anecdotal information we have from our local hospitals, is that the concerns have been there as well. So we've also had some great partnerships with our health professionals, working in the vaccine clinics, as I said, with hospitals and local agencies, but also with fire departments. And so again, there's just been very much a willingness to dialogue and collaborate, and it has worked great for us. We've also used worked with a lot of physicians in looking at our speakers and presentations that they've been able to do for us. And it's been great using Zoom. It's been a lot easier to access people and access physician time or other healthcare professionals. So we've been doing, we have local telebriefings with our LA County Department of Public Health, and they do them weekly for schools. They've even added some for school nurses in particular. So we've been doing that, where they'll give us a weekly update and the ability to ask questions and have some dialogues. At the County Office of Education, we've done what's called, they're kind of like a level alike meeting. So this has been for school nurses, and we call them school nurse chats, where, I will facilitate an update and then some Q&A and then some speakers. So we've had some physicians from Children's Hospital talking about MIS-C. We've had some pediatricians and sports medicine background to talk about return to play after COVID, in particular for our athletes. And then just a lot of Q&A working with school nurses. And then just recently we did one on returning, or are you ready reopening back for schools? And so did a lot of kind of a lessons from the field where those that have been open, those school nurses shared what plans and resources they have been using. So again, we've had a lot of good interaction and collaboration with our community health partners. So I'm going to turn this over now to Lori, and she'll do our last couple of slides.
Thank you, Susan. I'm going to give a little higher level perspective related to the work that NASN has been engaged in. We've had unprecedented opportunities during this pandemic for collaboration that are focused on driving better outcomes in our communities. And when I spoke with you when Susan and I spoke with you in August, we talked about the difficulty school nurses were having in access to PPE. And states used CARES funding to provide free PPE to schools, but it wasn't enough to meet ongoing needs. And so then states allowed schools to purchase through their state bulk purchasing contracts, but schools hit supply shortages that impacted their ability to access those supplies. So as a result, NASN engaged in a partnership with Get Us PPE. You're probably familiar with this not-for-profit organization. And through our work with Get Us PPE, they tell us that their largest requester for supplies is from schools, that 81% of the schools were public schools. And of that number, 83% were those low-income Title I schools. And that demonstrates just one of the inequities faced by these Title I communities. Additionally, the U.S. Department of Education Readiness and Emergency Management Center has engaged NASN and the National Association of School Psychologists to present a webinar focused on mental health. And Susan's talked about the need for that. You've heard much concern expressed about the impact of isolation on students, on families and staff. And that includes a lack of engagement in the education process, anxiety, depression, abuse, and neglect. And for those schools that have already returned to in-person learning, these concerns are proving more than true. School nurses are often the first to identify mental health concerns. Students somaticize those emotions either because they don't have the language or there's stigma associated with expressing them. But school nurses work with students to help them give voice to their emotions, to help them learn to manage those emotions on their own. And when students aren't successful in that efforts, or when the school nurse recognizes those mental health concerns are more severe, then they refer them to mental health professionals. I think what's important for us to recognize is that 70% of the students who receive any mental health services receive those services within a school, presenting concerns for a potentially overburdened school mental health support system as schools continue to reopen across the nation. Another partnership we engaged in was with the Healthy Schools Network to develop the National Call to Action, Pandemic versus Schools. And this plan provides extensive guidance for schools about selecting appropriate cleaning and disinfecting products, addressing indoor air quality and meeting ventilation standards, water intrusion into school facilities that are in disrepair, resulting in mold, safe drinking water, and school health services. We're collaborating with the Rockefeller Foundation to inform risk assessment and COVID-19 testing strategies in schools. And we're working with the Harvard School of Public Health COVID Collaborative to address infection control education for school staff. Some online modules that'll help school staff come up to speed on how to control COVID-19 in their buildings. Next slide, please, Susan. In the midst of the COVID-19 pandemic, there have been some bright spots. I'm sure you've seen them in your practice as well. Our members have really stepped up to the plate, leveraging their public health nursing knowledge to lead school pandemic planning and response. They fielded an unprecedented number of media requests to give local voice and an accurate narrative of our school nurse specialty practice. Susan's talked about how they've increased school connectedness with students who couldn't find their way to virtual education. And they continue that as students are not returning to school and addressing that chronic absenteeism that we know has significant impact on graduation rates and future earning potential. Through our member and other school nurses advocacy during NASN's virtual Hill Day, through social media engagement, and by adding their signatures for a petition to fund 10,000 school nurses, we have really gained ground in the support for student health. And very pleased when President Biden signed the American Rescue Plan that provides federal funding support for schools with the allowable use of hiring school nurses. You might recall from our August presentation that a full 25% of schools have no school nurse, and another 35% have a part-time school nurse. I should also indicate that this funding stream provides for schools to hire mental health professionals and other specialized instructional support personnel. I do want to talk with you about NASN's student-centered legislative priorities and ask where you can to lend your voice to our advocacy. The Improving the Social Determinants of Health Act has bipartisan support and would authorize CDC to prioritize coordination of social determinants of health activities across the CDC agency and with other federal agencies, and also prioritizes CDC grant funding for projects that address upstream solutions for social determinants of health. The Pandemic Child Hunger Act would extend free breakfast, lunch, and snack for all students to address food insecurity, reduce stigma associated with free and reduced lunch designation, and make sure children don't fall through the cracks. And then finally, the Nurse Act, or the Nurses for Under-Resourced Students Everywhere, would provide a demonstration grant for those Title I schools that we've talked about, providing students in those underserved communities with equitable access to school nursing services that are demonstrated to decrease absenteeism, improve health outcomes for students diagnosed with chronic health conditions, increase immunization rates, and lower vaccine exemptions. I'm curious if you know if your state has a state school nurse consultant. In 35 states, these consultants are employed by state departments of education or health, and they provide guidance and policy development for schools, help standardize school health processes across the state. They conduct data collection, analysis, and dissemination about statewide school health, and they coordinate grant funding for local health programs. Several states have a state school nurse position pending, California being one of those, New Jersey being another. 5 states have vacant positions, so the state has a position, but they've not funded it yet. So I'll encourage you to see if your state has a state school nurse consultant. Later on, I'll put a link in the chat where you can explore that. It really is a great opportunity, and school nurses where they have a school nurse consultant have applauded the work those consultants have done during this pandemic. Data are definitely showing that where mitigation principles are followed, schools can successfully and safely reopen. And we know that compliance with those mitigation principles seems to be stronger in the elementary grades than it is in intermediate and high school. And so I think that that's where our work needs to focus on reinforcing that if we mask up, if we follow distancing and cleaning and hand washing, all those principles, then we really can bring kids back to school where they need to be engaged in learning. This pandemic has been an extraordinary time of interprofessional communication and collaboration, a proven model that we know best supports health and wellness outcomes. And NASN and school nurses look forward to continuing these strategic relationships so that every student is healthy, safe, and ready to learn. I'd say a bright light has certainly been shed on the need for more sustainable funding for public health agencies to support wellness models, disease prevention, and emergency response. And together, we need to amplify this message to make sure that our nation is prepared to address health needs of today's population and in the future. And I want to thank you for the opportunity to speak with you today about students and school health.
Thanks to both of you, both Laurie and Susan. I learned a lot, and I have a feeling like our participants have learned, and panelists have learned a lot too. I'm gonna, Laurie or Susan, if you can take that slide down, we'll get back up to the Hollywood Squares. There's a few questions in the chat or in the QA. And if you have a chance, you can chime in on those. I'm first going to turn, my sort of plan here is I'm going to turn it over to Sandy Schneider first, then I'm going to go to the polls. There's about 6 or 7 poll questions, and then trying to get our finger on the pulse of clinicians and their connectedness to school nursing. And then I'm going to go around like usual to our panelists and then our speakers for final comments. So Sandy, please. Yeah, and I want to give a shout out to Sandy personally for helping me try to recruit some panelists who were emergency physicians who were absolutely laser focused on schools and school nursing, and they're all on spring break. So what the heck? So Sandy, to you.
Hey, what's the matter with spring break? Yeah.
No, it's all good. I told them, go on spring break, take a vacation. Yeah, absolutely.
So emergency physicians are interestingly tied very closely to a number of school districts, as well as on a more national front. And I think one of the purposes of having this as part of the emergency medicine clinical rounds is really to encourage other people to get involved because we bring a lot to the table. One thing I did want to mention for one of our members who is more nationally focused on school issues, he's doing a quick survey regarding temperature checks. I think all of us have now had that thing pointed at our head and nobody really knows whether it does any good. We don't even know if it does. It actually tells us what a temperature is or what the temperature is. But I'm going to put in the chat a link to his survey. It just takes a couple of seconds to do it. And if some of you could add to his data, I think he'd be delighted. So here goes. No, that didn't work. But anyhow, I'll put it in the chat. We seem to be having technical issues here all of a sudden. There it goes.
Yeah, thanks, Sandy. I got to tell you, when the whole school nurse and schools reopening thing hitting, in the summer, and it was even before then, I really thought a lot about, okay, so we've been very clinically focused in the hospital and so forth, but I think, Laura, you made a really great point about that collaboration, and Sandy Schneider has made that point to me about how these rounds can help connect dots, and hopefully this one will connect some dots some more. I want to go to the polls because I want to see where things are as compared to when we met with in August. The polling questions, there are some that are absolutely identical. So Echo, if you put up the polls, that'd be great. Okay, this is that, and if you just refocus back on the polling instead of email, it'd be great. And jump on these so we can move through them, so we can have some panelists weigh in on what they've heard. Be great. All right, people are really jumping on quickly. Appreciate that. Let's stop there. And 63% of participants voted on that. That's close to that anyway. So pretty interesting. It looks like school nursing, EMS, and emergency physicians principally. All right, next. Our emergency department has actively engaged, collaborated with school nurses regarding response to COVID-19. And I think I've worked in responses don't work at an ED. So for each one of these, everyone can respond to the polling questions. And the information that Susan, Laura, you shared about the support for school nursing that has emerged was actually really gratifying to see and hear. And it didn't have that feel back in August, that's for sure. Yeah. All right, let's stop there. 73% voted. That's the highest number ever. Okay. So yes, 9%, no, 26%. Then there's the don't knows and don't work at an ED. Looks like there's some opportunity there. All right, next, for all of you who are EMS providers and clinicians, the next question is actually for you specifically. Our EMS organization has actively engaged, collaborated with school nurses regarding response to COVID. Let's stop there. Goodness, it's almost like the same percent voted and it's like the same response. Wow. 9% yes, 26% said no. Almost identical to the emergency department. All right, thank you. Let's do the next one. Since COVID-19, our healthcare organization, and when I put organization down, that's code for EMS or emergency departments or healthcare facilities, has provided support for school nurses by, and then the following. Also, Susan and Laurie, I was struck by that interface with Get Us PPE. Wow. I'm absolutely aware of the organization. Actually, I think they may have, we had them on Rails, I believe, some of those, I think we did. And so it's striking to see that be a success story. And another 5 more seconds. All right, let's stop there. 63% voted. And this is strikingly diverse. A little bit of everything. All right, next. The school closest to where I am right now has 1 or more school nurses on site during all school hours, 1 or more on site during some school hours, school nurses on call but not on site, and then don't know. And Susan and Laurie, when I put this one together, it's like, I'm sure they would write that one differently. It's best I come up with as an ED doc, you know. I've actually spent quite a bit of time with children and school nurses waiting for the families to show up in the emergency department, but I haven't tapped into your organization at your level before, so. Yeah, I see in the chat a recommendation for an improved polling question. Let's stop there with this one. 71% voted. Really appreciate the responsiveness of the participants on these. Been great. I mean, yeah, there's not a lot. I mean, it's not like a polling with 5,000 participants by a long shot, but I am actually personally surprised by 1 or more on site during all school hours. I didn't think it would be that high. Next, please. And while people are responding, Susan and Laurie, did you expect that for like, in terms of like such a high percentage of with 1 or more on site during all school hours? Did that surprise you, or that's what you would have expected?
So
Go ahead, Laurie.
that's surprising to me. You know, we have some schools that have more than 1 school nurse in larger high schools. My experience is a school nurse in every school, but we know that's not the norm nationwide.
We're getting really close to like critical mass here on this one. Let's stop there. This actually is a really interesting, I hadn't thought about it before, but based on your presentation, clearly you've articulated some needs and some have been responded to, but also, how this matches with, clinicians who are not school nurses, their belief in what your biggest challenge is and, opportunities. Well, yeah, this was a good opportunity to do some education from your end for us. Really appreciate that. And I see the mental wellness of students really pops up too here. Adequate staffing, funding. And actually, when I looked at the August results, and I did a similar question, there were a few, I added in the mental wellness pieces, but very similar question back in August. And in response to that, it was the decreasing transmission that popped up by far. Is the most frequent response. Next, and I think this is the last question. The next question is the last question. And then we'll go around to our panelists for any comment, and then to Laurie and to Susan for any final words before we close. This is around telemedicine. All right, let's stop there. And 65% have voted. I'm particularly fascinated by, there's still, people that want to develop telemedicine capabilities. All right, let's stop there. And I think that was the last polling question. And go back up to Hollywood Squares after people have a chance to view this. And then I'll start with Harry.
Thank you for those presentations. I think this is a really important topic that doesn't get spoken about enough. A quick question, or maybe something for the future, question specifically about when classes are virtual or hybrid, what workarounds have school nurses found to address some of your challenges and your core mission? And in a similar fashion, a question about abuse and neglect, because it seems like school is often a respite for those children and young adults who are in abusive or neglectful situations. And how have you been able to try to key on that and get help to those students that no longer have that respite from those situations? Again, thank you for your presentations.
I can just say in general, nurses have been very creative in using all modes and means to be able to interact, to follow up, to help do case management, Zoom, phone calls, emails, even, snail mail, any ways that we can to help do that. But as far as looking at mental health and looking at child abuse and things, definitely the number of child abuse reports have dramatically decreased during this past year, because simply they're not at school with staff being able to make reports or to identify needs or potential needs. So we have done a number of trainings with our local Department of Children and Family Services, doing some trainings on what are some protocols or what are signs to look for, what are things, of something said in a chat room or something, things that they can look at that a teacher can either, they can, pull aside in a room or connect with the child afterwards. Or if there's just seeing signs, what is the school's protocol for then identifying so that someone can immediately follow up. We've also looked at not from also child abuse, but from mental health concerns, what are signs and symptoms that should be an alert. So working with teaching staff, what are our alert signs, what's our protocol for connecting them with our support services within our schools. And so really looking at what if it's an emergency? How do you deal with that? What do you, when you're on Zoom or online with a classroom, what are alerts, and then what is the process for connecting? So we definitely have really had to ramp that up and look at how do we address and support students while we're in virtual learning. So, but definitely a challenge, and very much looking forward to having students or some students that are back already, and more students within the next month will be returning to school.
And I just add to that, workers in the education community are the largest reporters
Mhm.
of abuse and neglect. And so all of those indicators that Susan's talking about, training for in a remote environment, what to look for, are critical to the health of these students and to getting families the support that they need, right? I mean, we've seen increase in, I guess, aggressive and abusive behavior in our community as a whole. And so we know that continues to be reflected down to our children. I wanted to take a moment, if I might, to respond to the poll about funding for school nurses. The majority of funding for school personnel, school nurses, comes from local education dollars. However, those dollars are raised. I know in my community that's based on property tax. And so as the economy goes and housing values go, so does funding for schools. Nationwide, that's almost 77% is local funding. Another 17% comes from the state. Some districts have health department or foundation funding. About 12% comes from the federal government in title funding, Title I, Title II. And then some hospitals provide the staff for schools. But what I think is really important, and I'm not sure that everyone is aware of, is that schools can get reimbursed for Medicaid services that they provide to Medicaid eligible students. And through that program, schools are receiving only about 1% of the total Medicaid budget, even though 51% of schools are billing Medicaid. And what that is, that provides a model of third-party reimbursement for school services. And if schools were able to request reimbursement from other insurers, that could support the staffing of school health teams. So I think it's something that we hope to look to in the future. As I said, we have a many years model of efficient and sustainable funding for Medicaid eligible students.
Laurie, that's new information to me. Maybe others have heard that, but it's not new information to me. And my guess is, while in your leadership role and Susan's with your association, certainly that promulgation, but I have a feeling that other organizations who are represented on this clinical rounds, emergency medicine, EMS, emergency nursing, et cetera, I'm sure would, I'm sure the opportunity is there for you to reach out for dialogue about that particular issue. Yeah.
Great.
Yeah, I'm pretty certain about that. So let's see, Dave.
Yeah, those were wonderful presentations. And one of the questions I wonder, and maybe I'm wrong, but my impression has been that school nurses are really focused on the students. And I'm wondering if that role has expanded to include more of the teachers and staff as schools reopen, and seeing, perhaps problems where those folks are at work and they can't really access their normal healthcare providers.
My personal experience is that in my 25 years in a public school district, I was always taking care of the staff. I mean, you're a trusted member of their community, right? They come to you for advice. They come to you because they're not feeling well. They come to you for their blood pressure check. So while certainly the mission is student focused, we know that where our school districts and our contracts allow, we are providing care for the staff so that they can remain in the classroom, or that we can help them recognize that their being in the classroom isn't safe for the students because they have an elevated fever or whatever the case may be. So I think that's amplified during COVID. Lots of health education going on with the staff, reassurance, helping them, to sort out what their symptoms are related to. Do they have a chronic health condition that they need to attend to, that maybe it's not COVID? So always been a part of my work. I don't know about Susan.
No, definitely always been a part of, yes, our focus is on students, but we're also focusing on staff. I think my first week ever over 25 years ago was, I don't know how many staff that were lined up to see me and kind of see what would I advise. So, always referring them back to their healthcare provider, but helping just to guide them and provide that, oh, I was diagnosed with this, what does that mean? And helping to explain things and understand. But I think especially during this pandemic, we've also been very focused on not only the students, but how do we support our staff as well, in particular with their mental health needs, or recognizing, that they're having some issues, or some of those physical symptoms may be related to mental health as well. And I know in general, our County Office of Education provides employee assistance programs, and not all districts are required to participate or to have a contract with that. And it has just skyrocketed with the number of districts that have accessed our mental health services, our employee assistance services. So yes, definitely. Not only are we supporting students as they come back to school, but we're also supporting our staff. I know lots of just having in our bag of tricks things for self-care and promoting, and it's okay to take care of yourself, and you need to do that, particularly if you're going to be working with students back in the class, because they're going to have needs and they can't help support their needs unless they're also addressing their own needs. So definitely, yes.
Thanks. Dan, Gerard, any comment before we go back to our speakers for final word?
Just two quick questions. The first one, what are just maybe one or two things that you learned that you're going to apply in the future for future incidents, and not necessarily related to pandemic? It could be anything that would be like a larger or longer scale sort of thing that's going on. And then finally, as EMS and emergency room providers, what can we do to help support you in the future? Thank you. Great presentations by both of you. Thank you for your hard work and your diligence.
So I think what we really learned is really just continuing to facilitate those conversations, those relationships, and those conversations that we've had with other healthcare professionals have been invaluable. And maintaining those relationships, that will help provide future resources or interactions or collaborations on other projects. But I think keeping school nursing at the forefront and the impact that we can make with students. Certainly with our safe schools planning, whether it be just safety in general, school culture, school environment, including, pandemics or whatever other emergencies. There's just been so much that we have learned throughout that, we have benefited a lot, unfortunately, but we have, in making those connections in looking at different strategies, looking at the voice of school nursing within the school structure and framework, that they are a valuable team member. Typically, it's kind of been yes, the school nurse is important. We have them there, and it's kind of like, but we don't really, unless there's something emergency or something going on, their voice isn't always invited to the table. And I think this has been an opportunity to showcase that school nurses have a lot to add to those conversations on any topics related to school, really, because there's always that school safety, that school health component. And so I think that's allowed us to have a increased presence at the table for school decisions.
I would say that we've learned that the lean startup model can and does work, that even when you don't have all the answers and where there's conflicting guidance, that you make the best plan you can with what you know, and you adjust in real time. And I think that's an important lesson for school nurses on the ground, and also for our organization. We have learned that if we listen to our members in our online forum, that we know exactly what content they need. Some of them are resourcing the content, and then we as an organization can turn that around to them in a fairly quick manner if we just stay plugged in with the membership, right? So I think it's been a really great learning opportunity for us as an organization of how to better work for our membership to support students.
Laurie, I think I'm really glad this is recorded, because I think you basically just made the pitch for Rounds, learning together on the fly when there's no data. I think you just made that pitch for us. So I really appreciate that. Any final comment from Susan before we close? Susan?
Just for, echo last time when we came on, it felt really good to feel that there were so many other healthcare professionals that wanted to know how they could be supportive of school nursing. And it was really encouraging. And so again, I thank you for the opportunity to be here and to share, and hopefully we're all learning more from each other about our different roles and how we all fit onto the healthcare team. So thank you so much for the opportunity to speak again.
Absolutely. Our collective pleasure, for sure. Speaking on behalf of the group. Laurie, any final words from you before we close?
Well, I appreciate this opportunity, and I'd like to respond to how can those attending help. There's a comment in the chat, and I presume it's from a school nurse, who talks about the budget for an entire district of 800 students for a school nurse. So a supply budget is $750 for an entire year. My experience as an administrator in a school district, and had 50 schools, and budgets were campus-based, is that some schools had 25 cents a student and other schools had $7 a student, based on an active parent-teacher organization with funds to donate. So if you're working in a low-income area, maybe if you reach out and find out what does that school need to support student health? So stay local.
No, thanks very much, Susan. Thanks very much, Laurie. The one thing I've found particularly gratifying about this round is, you know, talk about the learning together, listening to your members, and you had, I mean, you were faced with such, we all learned from you back in August. And at this point in time, it just has this feel like not only did you like rise to the challenges, but you've basically been able to advance school nursing in ways that you might not otherwise have had the opportunity to do. And so, hey, congratulations to your association and the members. The one, okay, a very paternal doctor, my wife would say, yeah, like, listen to the doctor, right? You're just another person. But my thoughts as we close are, I really hope that you and your colleagues take a deep breath and take vacation like my colleagues are taking spring break. I really, really think that you need to take some time for yourselves, because our future, nobody alive except somebody 102 years old and older has ever gone from pandemic to a new normal. And really recommend to all of us, take a deep breath, take some time. And because what we're about to, our reentry could be quite fascinating, back to whatever that new normal is. So be careful with yourselves and each other. And yeah, so thanks very much to our participants that have hung on this long. Thank you, and to the ones that have already left. Great participation in the chat and in the polling. To our panelists who always are there for us. Thank you. Echo, great. Thanks. And to Susan and Laurie, please, on behalf of the rounds, and I think we got something like 45,000 participants so far of rounds who've participated since we began. On behalf of us with rounds, best wishes to you and your colleagues in school nursing. With that, thank you and goodbye, and we'll see you on the next one. Don't forget that like 1 year plus a day anniversary next Thursday. Okay. So anyway, take care all. See you next week. Bye.